Hey guys, so invest if you are serious about passing NCLEX. That ends this week, and again we are studying nursing priorities. Nursing priorities. So let's get into it. Let's get into it. This is it. This is it. This is where comments on the screen are super important, and we have the ability to help each other out. All right. First question is this. First question is this. A nurse manager on a medical surgical unit has noticed a newly hired nurse appears frustrated and has already made a medication error. Which initial action should the nurse manager take? Here we go. Is it number one, issue a verbal warning? Is it two, create a plan for performance evaluation? 3, schedule a meeting with the nurse. 4, determine if there was a medical documentation systems error. What do you guys say here? We are talking about what happens when you have a newly hired nurse. They are frustrated, and also they have already made a medication error. What is going to be the best? What is going to be the best situation for that nurse manager to do? Okay. All right. I see the answers on the screen. Great job, everybody. This is what it's about. It is about going with your first mind and committing. Okay? Committing. Hey. Also, shout out to all the nurses that come on and let me know that on this Monday, you have a reason to share some motivation when you pass NCLEX. Congratulations. Congratulations. The correct answer, you guys, is number 3. Schedule a meeting with the nurse. All right, that is going to be the most important thing for the nurse manager to do, because it does create a culture of safety. It does create, the ability for a new nurse to feel comfortable that if she makes a mistake, she's not going to just get fired right away. That keeps a lot of nurses not growing, because if you're afraid to ask questions, if you're afraid to make mistakes, then you will try to hide your weaknesses. And when you do that, people get hurt. So the best thing for the nurse manager to do is schedule a meeting with that new nurse that has made the medication error, because you want to get input. Hey, what happened? Did you just not pay attention? Were you frustrated? Is your patient load too much? And then once a nurse manager has that information, then they can go ahead and put in the right steps. Okay. All right. Here we go. I love I gotta stop and shout out the motivations, because you guys take time to share it with me. Julie says, by the grace of God and the REMAR review program, I am finally a RN. We can, we will, we must. To God be the glory. REMAR Nurse 2021. Hey, I still join all the reviews. Thank you, Regina. I graduated college in the 1900s. My goodness, how amazing. 1998, you did it. I love that. That's motivation for everybody. I could end the program right there. How many of us were born in the 1900s and we're still on the road to nursing? Amazing. All right. Here we go, guys. Question number 2. Oh, this is a good one. Here we go. A LVN is on a unit with 3 RN, okay, 2 LVNs, and 1 nurse's aide. Which patient is the LVN most appropriate to care for? And you guys know you can see LVN or LPN. They mean the same thing. So out of these 4 patients, who's most appropriate? We have a client with cervical cancer who is refusing to take her medication, a client with a colostomy having difficulty irrigating the stoma, a client with left side CVA requiring assistance with a bath, or 4, a client with an arterial catheter needing assistance ambulating down the hall. So which one is that LVN most appropriate for? Okay, I'll give you guys a minute to put the answers on the screen. But remember, with the LVN, what type of patients do we want them to have? What types of duties is it important for them to be able to master? Because a lot of people think that the LPN is not as versatile, not as knowledgeable as the RN, and that's not the case at all. I actually know LPNs who could literally run circles around RNs. They have a lot of experience and they make really great decisions in their scope of practice. But in general, for the NCLEX exam, what kind of patients do we want the LPN or the LVN to have? What are you guys saying? Yeah, so here we have, looks like a consensus of what you guys are thinking. Is there anyone different? Couple people. All right. So the correct answer for the LVN is going to be 2. It is absolutely going to be 2. The client with a colostomy having difficulty irrigating the stoma, and this patient is the most stable patient. So if you think about the other patients that we are given the option of, the first patient, it says the patient with cervical cancer refusing to take their medication. So if you have a patient that is refusing to take their medication, what type of nursing care do they need that the LVN would not be appropriate for? Okay. What is it that this person needs that only the RN can provide? What do you guys think? We have a patient and they're refusing to take their medication. Why do we want to send the RN in there? What's the problem? What's the issue? Yeah, what I'm seeing. Yeah, the patient needs teaching. They need education. All right. They need an assessment. Okay. So if I have a patient, they're refusing to take their beta blocker, I have to be able to tell them, listen, this medication is going to reduce the headaches that you're complaining about, right? Because sometimes people don't really grasp the numbers. So you can say, oh, we want to bring your blood pressure down into a normal range. Okay. But if you say, right, the dizziness that you're experiencing, if you take this medication, it will help those things. That puts it more into a practical situation for the patient to take the medication. All right. So remember that. All right. The other patient was this. I'm going to just read it. It's the client with the left side CVA requiring assistance with a bath. Okay. So who is going to be more appropriate for this? Who is going to be more appropriate for this patient? Okay. It's not the LVN. I will see nursing students pair the LVN or the LPN with activities of daily living, right? So if a person needs a bath, a lot of registered nurses will think it's the LPN's job or it's the LPN's best action to give that patient a bath. No. Okay. No. The LPN is a nurse. They can do many important things. They can do many important things such as medication. They can do wounds, right? And I see some people are like, preach it, but it's true. It's true. The LVN is a nurse. They are educated. They are licensed professionals. So I would never send the LVN in to do a bath when I have a nurse's aide that can do it, right? We need our LPNs working, right? In the nursing scope of practice. Okay. And the final patient, I'm staying on this for a little while because I think we need to clean up the delegation here. Is an arterial catheter needing assistance ambulating down the hall. All right. And so this patient, although the task is what? Although the task, you guys have to be very careful because the task here is ambulation. But even though it's ambulation, this is the RN's patient. This is not the LPN's patient. This is not the aide's patient. The RN needs to ambulate this patient because they have an arterial catheter. And an arterial catheter is something that is very sensitive. It's literally monitoring the blood pressure from inside of the artery. So if you lose this catheter placement, not only are you going to be, not only are you going to have a huge mess, blood is going to be everywhere because you guys know how the arteries spew out blood, but also you have lost a way to really monitor your patient. Usually patients with arterial catheters are in the ICU, so they're not even appropriate without that really close nursing monitoring. All right, so here we go. Now this is it. We're going to move on to the next question. We did delegation. All right. A nurse is caring for a client diagnosed with a DVT, right, of the right leg and swollen toes. The client states they have pain 7 out of 10. What is the initial action of the nurse? What is the initial action of the nurse? Okay. Is it to notify? Is it to notify the physician immediately? Okay. Is it to check client's oxygen saturation? 3, assess the distal pulses. Or 4, apply ice to the right leg. Okay, and we see the situation here. So you have a nurse, they have a client with a DVT, and the leg and the toes are swollen. Okay, and the patient, they're complaining of pain. They are complaining of pain 7 out of 10. All right, what is the initial action of that nurse? What's the initial action of the nurse, guys? And I want you to think about patient safety. And I see a lot of people picking 3s. Is there anybody that wants to pick a different answer? Is there anybody? Most everybody's picking 3s. Everybody's picking 3s, okay? And listen, I'm not saying anything to change your mind. I just want you to be convinced in your own mind what's the best thing to do. And so in this situation, the best thing to do is pow. You got it. You have to assess the distal pulses. Because what this patient has is expected, okay? Everything that this patient has is expected. So we know that they have a DVT. So when a patient has a DVT in their leg, will that leg be swollen? Yeah. Will the toes be swollen? Yeah. Will the patient say, it's hurting? It's hurting so bad. I have pain, right? Yeah, they're going to say that. Is it going to be bad? Like a 7, a 6, an 8 out of 10? Yeah. So I'm expecting all these things. So if I call the doctor and we all know that the patient has a DVT, it's no mystery, and I say, doctor, the patient with the DVT says their legs hurt and they have swollen toes and a swollen leg, what is the doctor going to say to me? The doctor is going to say, Regina, is there anything else you want to tell me that I don't already need to have some more information for that doctor before I call them? That is why the first step in that nursing process is assessment. You have to be able to know what is going on with the patient. So if I can say, you know what, the pulses are still there, right? Because I checked the pulses, that's going to make me look like a more competent nurse, right? And then that will help the doctor make a better decision. Because remember, nurses, when we call the doctor's not there. So everything that the doctor needs, guess who they have to ask? They're going to ask you. So you better be ready every time you call the doctor to have information. You better know what the vital signs are. You better know when the patient last ate, what did they drink, how much urine have they put out in the last hour. Calling the doctor is a serious event. Okay, and a lot of new nurses do very poorly because they don't have the information in front of them when they call the doctor. Never call the doctor without the patient's chart open. Okay, we can get into this all day. This is the training ground to be an excellent nurse. I'm glad you showed up today. All right, the correct answer here is number three. Number three. Here we go. All right, guys, and really, I'm talking about being a great nurse, but honestly, this is the first step to get you there, because a lot of stuff that you learn in the virtual trainer is going to help you be a better, well-rounded nurse. So get into the virtual trainer system, get your license in 4 to 6 weeks. We are moving on. Here we go. A nurse's aide is caring for a client who has not had a bowel movement in 2 days. Which action is most appropriate for the nurse's aide to take? Number 1, ambulate the client to promote gastric movement. 2, offer the client milk if the client is lactose intolerant. 3, offer the client prune juice. 4, report the finding to the charge nurse. Okay. All right. This is interesting. This is interesting because this is part of education. This is part of education, evaluation, but not, I don't want to use, let me take back that word evaluation. All right. Because we are talking about what can people do here within their scope of practice. Oh, this is so good. And oftentimes I talk to you guys about what the RN could do, what the charge nurse should do, what the LPN can do. But what about what the nurse's aide can do? What about what the nurse's aide? A lot of times they will call them unlicensed care providers. Unlicensed care providers. So given the choices here, what is the best thing? What is the best thing that nurse's aide can do? So good. And I see people are down to 2 choices. They're down to 1 and they're down to 4. I love it. I love it. All right. Correct answer here, guys, is number 1. It is number 1. Get that client up and ambulate them. Okay. Get that client up and ambulate them. Activity is an effective way to produce intestinal movements. It is a way to get the body in a normal functioning cycle, right? We don't want to add food, right? We don't want to have that nurse's aide making dietary decisions. So giving the client milk, giving the client more food, prune juice or whatever, the better thing to do is to say, hey, Mr. Smith, how about we go for a walk? You know, how about I take you on a walk down the hall and back, right? The nurse's aide has the capacity to do that. Remember, their scope of practice, which they don't really have a scope of practice without a license, but they do have training, right? And in their training, in their understanding, they have the ability to add activities of daily living. So they have the ability to walk the client. They have the ability to feed the client. They have the ability to dress the client. But those should be done under appropriate circumstances. So we know for constipation relief, right? Ambulation is best to help with isometric exercises, right? Get those muscles, get those joints stretched out. These are things that can be done through walking, right? So, and here, it is, I don't want you guys reading into it, right? I don't want you guys reading into it. It doesn't say that this patient is on bed rest. It doesn't say that they have any mobility issues, okay? It doesn't say that they have any mobility issues. And I'll just address number 4, because a lot of people did pick number 4, which is report the findings to the charge nurse. Yes, the nurse's aide can do that, but there's also the understanding that if you can help the patient, then you help the patient, right? You don't necessarily pass the buck to somebody else. And that's on every level of nursing. That's on every level of nursing. So for me, this question could also say, a client says that they were thirsty. What should the nurse's aide do? Is it report the finding to the charge nurse or give the patient a glass of water, right? What should the nurse's aide do, right? The nurse's aide should perform to the highest level of their training. And this is the same here. So I want us to make sure that we understand on every level how nurses can function, okay? All right. I read too much into the question. Yes. It happens. Here we go. Question number 5. What is this one? A nurse gave medications to the wrong client. She stated the client responded to the name called. What is the nurse's appropriate documentation action? Is it 1, note in the medication records the drug given? 2, the client was not hurt, no need for documentation. 3, note the client's orientation. Or 4, completely fill out an incident report. What do you guys think? Can, will, must pass NCLEX. Can, will, must pass NCLEX. This is it right here. This is huge for safety. I can't stress this enough. You will make mistakes in nursing. But what do you do? Also, share this video if you thought the questions were challenging and you want to challenge your friends. Smash that share button right now. Okay? All right. The correct answer here, love to see it, guys. The correct answer is going to be, you got it. Yeah, you got it. It's number 4. I like that. Relia, is that how you say it? I like that. Incident report is for you in the facility as a learning experience. Don't be afraid to fill out an incident report, and it should always be filled out. Remember, you never want to put it in the chart, okay? Why don't you ever want to put, there's a reason why there's an incident report. And there's a reason why incident reports never go into the chart. They go into a separate system. You never want to put a mistake in the chart. And the hospital, they will teach you that, or it should teach you that during your orientation, because literally everything that you write down in a chart is a legal document, right? And so they have a place where they reserve incidents and centennial events and abnormal occurrences so that the hospital has a way essentially of protecting themselves, right? Essentially protecting themselves against many legal ramifications that can come. Now, whether you guys believe it's right or not, or you want to work for hospital systems, that's your decision, but it works. So if you make a mistake, you definitely have to document it. But where you document it is in the incident reporting system and never the chart. Right? And so you guys know that. Okay, here we go, guys. This episode of How to Pass NCLEX was brought to you by Quick Facts for NCLEX. You can get it. Every nursing student should have this book. You can get it Law. You can get it Amazon. You can get it from the Remar Nurse website. Hey, and yes, I hear and I see the comment. Is there any sale going on for the VT? It's too expensive. Hey, how about this? Try to use the code INVEST and it will give you 20% off the virtual trainer if you're interested in it. Now, this is important because this code ends this week. So this is the final week. I want to take you guys into our Monday motivation topic, and it is this. It's lessons from a toy box, okay? Lessons from a toy box. And you guys know all of these things are really personal to my life. Challenge. Okay, I'm gonna pull out a toy and I want you to name it. Now, you may have never seen this toy before, but I want you to just name this toy if you know it. Okay, so here's the first one. This is the first one right here. Okay, I know I have some parents in here that is familiar with this thing. Now they have objects that the kids play with, right? That the kids play with. So this is it right here. This is it. And I see everybody, they know it. They know it. I'm trying to get the comments up here. Somebody said, I don't have girls yet. Is this a Polly Pocket? Not quite. So this is an LOL doll. Okay. LOL doll, a beanie baby. Oh my goodness. This is the LOL doll. Okay. Next toy. Next toy is this. All right. I have a love-hate relationship with this stuff. My kids love it, but it gets everywhere, especially if you have carpets. All right. I'm going somewhere. Stick with me. Stick with me here. All right. What is this? What is this object? All right. Kids have it everywhere. It breaks up. They need to find a solution for it. I see it. I see it with the comments. So this is Play-Doh, right? Play-Doh. Lessons from a toy box. All right. Final toy. Final toy. Play-Doh. You guys know it. You guys have kids. You were a kid at one time. So this is the next toy. I don't know if you may know what it is, but it is a large version of a toy that my kids love. This thing. They love it. What is this thing? All right, here we go. This is Monday motivation, guys. This is Monday motivation. What is this, right? What is this? This is the wonderful. It has a song, and I don't remember the song, but it is the best, right? It's a slinky. This is a slinky, and so I bought my kids one of these. And literally, you guys know, when you buy this toy, there is literally a way that you have to play with it. And it's very simple. And you try to explain it to your kids. And I'm like, okay, guys, this is how you play with this toy. I'm trying to show them when you play with it. Mark's trying to show them, you need to play with this toy in this way, because if you mishandle this toy, what happens to it? Literally, you can have this toy for life, or you can have this toy for about 30 seconds if you don't handle it the right way. Because if you don't handle this toy the right way, what happens to it, right? What'll happen to it is it'll end up looking like this. It will be a kinky mess. Yes, it will be a tangled everywhere. And so I have 3 kids. Guys. I have a 1-year-old, a 5-year-old, and a 7-year-old. And they have had many slinkies, because no matter what I do, they'll get them tangled. And so this is what I want us to think about for 1 second. Think about the slinky, and when it looks like this, there are two possible solutions, okay? When it comes to getting the kinks and the twists out, there are 2 possible solutions. Stay with me here. What are the 2 solutions that you can do for the slinky, right? If you want to keep it, if it's very important to you, if it's not something that you want to, take away from your children, what can you do when it's all tangled up? What as a parent can you do? Yes. You can take the time and you can address the issue. Or if your kids bring it to you and it's all tangled up and you don't want to be bothered with it, the next thing that you can do is just what? You can throw it away. So literally, you can address the kinks. I'm going somewhere. Stay with me, guys. You can untwist it. Yes, you can address the kinks of the thing, or you can throw the toy away. And looking at these two solutions, they require different actions. I like that. You can learn to, you got to keep it safe. I wasn't even thinking, I like the way you're going there. And so if you think about, okay, what are the steps to throwing it away? What are the steps to throwing it away? What are the steps to working out those kinks? So if you're just throwing it away, if it doesn't mean anything to you, if you are not particularly fond of the slinky, you just gather it up, gather it in a big ball, whatever it is, wherever it is, and you dump it. You don't think about it again. But if you are willing to work out the kinks, if you are willing to untangle it, if you're willing to value it, you make a plan. So you lay it out, you make a plan. Okay, I need to start at the bottom or I need to start at the top. You look at where it is kinked, you're finding the flaws of it, and you fix it. And this requires time and this requires patience. Are you following me? There are two ways that you can handle a kinky situation. All right. And most of you know that where I'm going and where I'm trying to take you for this week is that you are the slinky. Yes. Yes. You are that thing. You are the slinky. You are the one that was presented, right? And through life, through challenges, we get twisted, we get turned up, we have flaws, right? And some people can see the flaws and some people cannot see the flaws. But the idea is this: in your life, there will be twists and turns, right? And this right here. So this week, our Monday motivation is this: are you going to work out the kinks instead of throwing the gift away? Okay? Are you going to be able to have the patience that's needed? I want you to be able to choose to work out your kinks. I want you to be able to choose to see. I want you to be able to choose to see the value, because this is what happens here. This was not a perfect slinky. You can see that it had to be repaired, right? It's a little out of line, but it is still a wonderful gift that I have given to our children, right? But it was a process where it was tangled and we had to sit down and we had to unravel it, right? Because it meant a lot to us. And you guys understand this principle that in your life, you have incurred some damage. You have incurred some kinks and twists. And so I wanted to remind you guys, this is this scripture right here. No weapon that is formed against thee shall prosper. All right, Isaiah 54:17. And here's it right here. It doesn't say that you won't have any weapons, right? It doesn't say that you won't have any kinks. It doesn't say that. It says that the weapons that are formed against you, the kinks that are in your life, those situations that have caused you some setback, they won't have the victory over you. Okay? They won't have the victory. And so you have the ability to look at your life, look at the flaws, the kinks, and say, I'm going to, with God's help, work that thing out. I am worth it. I am worth making a plan. I am worth laying it out there, right? And so this week, anything that comes up against you that you hadn't planned, I want you to decide to work it out and not give up. I don't want you to throw away your goals, throw away your dreams. All right. I want you to think of the slinky. I want you to think of the toys in the toy box, the simple things we are trying to teach our children every day, right? That we have to apply in our own life. All right. We have to apply in our own life. So I want to thank you guys so much for attending How to Pass NCLEX. This is a very special time that we come together as a community and we spend helping you stay on track, This is for you, right? Until you get your nursing license. And even after, I guarantee you'll still come here for Monday Motivation. So, hey, if you are taking the 30-day challenge, we are still in it. We are still in it every night. We are getting it done. And if you're serious about passing NCLEX, get in the virtual trainer, make the steps, have the plan, use the code INVEST, 20% off this week for that discount. And let me tell you a little bit more about it. The NCLEX Virtual Trainer is the best training system ever created for nursing students who need to pass the exam and get their license. In this NCLEX review, you're going to get all of my content lectures, and you're also going to not only get the content, but I have the questions, and the questions are so important for accountability. This is the system that you guys have been waiting for, and right now we have an amazing opportunity for you to get started. I'm going to send you the book as well that you need, not one book, but 2 books, the quick facts for NCLEX, right? This is an opportunity that you don't want to miss. If you need to get your nursing license in 6 weeks or less, get in the #1 training system for nursing students to pass NCLEX. Click the link below. I'll see you on the inside. What are you waiting for? This is the opportunity that you have been praying about. I want you in the virtual trainer. I want to see you there. The time is now. Get your nursing license. This is it. Okay, and